Today we will discuss surgery and infectious disease. We have a 32 years old male that comes to the ED after a motor vehicle accident. His vitals are 37 degrees Celsius, 142 beats per minute and 80/48 blood pressure. On the abdomen there is a seatbelt sign. The patient has confusion with a Glasgow Coma scale of 12. The abdomen is tense. However, there is no abdominal pain and there is also no abdominal rigidity. What is the best next step in this patient's management? Do a diagnostic peritoneal lavage, do a CT abdominal scan, perform a fast scan, or do directly an exploratory laparotomy. The correct answer is indeed a fast scan, as the patient has a blunt abdominal trauma. There are no signs of peritonitis, namely rigidity or pain, and the patient is unstable. Therefore, he should undergo a fast scan. A CT abdominal scan can be considered if the patient is stable. An exploratory laparotomy is used if there are signs of peritonitis, such as rigidity with abdominal pain, and the diagnostic peritoneal lavage could be used if the fast scan unavailable or if the fast scan is unequivocal. When we have such questions on the boards, there is a certain algorithm to apply for the blunt abdominal trauma. In patients with blunt abdominal trauma, we assess firstly for signs of peritonitis. If there are signs of peritonitis, this is an indication for exploratory laparotomy. However, no peritonitis means that we analyze the hemodynamic state of the patient. If the patient is unstable, we proceed with a fast scan. A positive fast scan is an indication for exploratory laparotomy. Further down the diagnostic tree, we have a negative fast scan that has two options. When there are signs of extra-abdominal bleeding, such as bleeding from the limbs, then we manage accordingly, for example, applying a tourniquet. However, there are no signs of extra-abdominal bleeding, we proceed again with exploratory laparotomy. By contrast, when the fast scan is unequivocal or it is unavailable in the emergency department, a diagnostic peritoneal lavage will substitute it. On the other hand, if the patient is stable, we perform a CT abdominal scan.